Our webinar today is being presented by Tamara Olson, the Idaho Immunization Program Vaccine Operations Manager. She's going to be presenting on the provider re-enrollment utilizing IRIS, which is a new process we're doing this year. All right. Tamara, whenever you're ready.
Good morning. Can you hear me okay?
Yep.
Okay. So welcome, everybody. Thank you for being here with me this morning. I am pretty excited to walk you through a demonstration of our new online re-enrollment that we are conducting through IRIS. I really think that while this is our first year, so we're all going to have a little bit of a learning curve just learning a new system, that this process is going to save us a lot of time and hopefully make that re-enrollment a little bit easier for everybody. So I'm going to start with, here we go. Just as a reminder, for those of you who have been enrolled in the program, you're aware of this, but for somebody that might be new and is not familiar, it's a requirement of the Federal Vaccines for Children program that all providers who enroll re-enroll on an annual basis. And this allows us to look at your populations to see if maybe you see more Medicaid kids, maybe you see less Medicaid kids. It lets us look at the number of physicians in your office. So maybe the number of vaccines you give has increased because you've added a couple of doctors. Maybe you have expanded from seeing just infants to now you see teens and adolescents. So it's just every year gives us an opportunity to kind of look at the population out there so that we make sure that we have the funding and the vaccine that's needed to make sure kids get vaccinated. So typically we open up re-enrollment in May, and you guys get a large packet of paper distributed to you through the mail. We post that online, and then we evolved a little bit, and there's a PDF you could fill out online also to fill out that paperwork to try to help. But we have worked it all into the registry, like I said, and hopefully all of that paper that you send in, you're not going to see. You're now going to log into IRIS and walk through the process. So what I'm going to do this morning is actually walk you through the process. My hope is that it is pretty user-friendly, and it won't be too startling, or it won't be something that you go, oh my gosh, how am I going to do this? And then that you will be able to look at the guidelines and maybe look at this webinar if you have questions, but most of it's pretty self-explanatory. So I'm going to go ahead and get logged into IRIS. So those of you who have IRIS access as an admin for your office, which means that you can order vaccines, which is typically the primary and backup coordinators in your office. Sometimes you have an office manager who also participates or is part of that vaccine ordering process. Someone who has control of inventory, that is the person that's going to have access to the VFC re-enrollment. So I'm going to log into the registry. Some of you have access to more than one organization. So to be clear, you will have to complete this process for each organization. There's not a way to select multiple PINs and then fill out that information just once. So for each organization, you will have to go in and fill out the information. So this morning, we're going to go into Russet Pediatrics and walk them through the re-enrollment process. So here's your IRIS screen, which most of you have seen and are very familiar with. You'll see that I'm logged in as an admin user, which is going to be the majority of you that work through this process. Down here at the bottom of your menu bar, over here in the blue, you'll see VFC re-enrollment. So we're going to start right here at the top with the provider agreement. So I'm going to click on provider agreement. And that is exactly what I'm going to see. So anybody that's gone through the re-enrollment, all of this information is going to look very familiar to you. It's just maybe in a little bit different format and hopefully a little bit less process for you as far as the work that you have to do. You do still have to read all the documents. So remember to make sure that you read and go through this provider agreement, because this is what you're doing right now, is re-enrolling and say, yes, I understand what the requirements are to participate in the program and to get vaccine from the immunization program. And so you want to look through all of this, okay, and read through it. When you've completed that, you're going to hit the next button at the bottom of the page. And now you're going to have the enrollment documents open. So the first thing I want to point out across the top is what is called a bullet train. And basically what this is it's a task bar, and it's going to track and document each piece of the process that you have completed. So right now you'll see you've got 5 steps. They're all open circles. As we complete each of the steps in the process, the circles will shade in green, okay? So your very first section is just the demographics of your office. Your office name, so if for some reason your name has changed, this is where you can let us know. Make sure that you don't ever remove this PIN number in the front, but you can make adjustments to this name that's right here across the top. Your county, telephone number and fax number, an email address, and this is the email address of your organization or of your clinic. This is if someone needed to get a hold of just the clinic, you wanted to put that email address in here. Next, you have your physical address. Where is your office located? A mailing address and a vaccine delivery address. So if your address is the same for all 3, you actually can just click this box and it will populate this information. So you'll see that there's some information already in here. The first time we go through this process, you might have to fill in some blanks, but then each year that you log back in to do the re-enrollment, this information should all be populated for you. And for the most part, you're going to go through these forms and just verify that the information is still current. There will not be a lot of information that you're going to have to add or include. So it should already be there for you, which should save a lot of time. Okay, so if we look at all of our address information, we see that everything's there. The next thing we want to do is make sure that we have a medical director or equivalent, okay? Someone that is signing on behalf of the organization. Remember that this has to be someone with prescribing authority in the state of Idaho. And this has to be someone who is willing to be responsible for your organization to make sure you're requiring or that you're following the requirements of the program, and also someone that's able to make financial decisions for the organization. Okay? So you want to make sure you have first name, last name. A title is required, so you want to make sure you have that information in there. You will add a medical license number and an NPI number. If there's not an NPI number, then you can also use a Medicaid number. And then also an email address. So it is required to have an email address for the medical director. This is the person that's going to sign the paperwork and officially enroll your organization into the program. So this is the person who will get an email when you're all done with this to review and sign. So it's very important that this name is the actual name of the person who will be signing paperwork for you during this re-enrollment session. And it's also really important that you have a correct email address because that's how they will get notified. So that email address has to be correct. So just kind of watch that as you go through this process. Next, you're going to include, sorry about that, your vaccine coordinators. So remember that each organization needs to have a primary vaccine coordinator and a backup vaccine coordinator. So needs to be different people, cannot be the same people. Now, if you are one of those smaller offices, sometimes your medical director is also your backup, and that is okay, but the primary and backup just have to be 2 separate people. Once again, emails required. Make sure you have that information because there will be communication that comes out of IRIS at the end of the enrollment, so that information is emailed to you. So if we don't have an accurate email, we can't send the information. So with the primary vaccine coordinator, we've got Hash Browns O'Brien here. We've got her phone number, an email address. Then the next section is you need to update, and this is something you'll have to do annually every year. Okay, this is something you'll have to do is look at if the annual training requirements have been met. So basically you want to go back and as of July 1st of the previous year, what education have you participated in? So Ms. O'Brien here participated in an enrollment visit with the Idaho Immunization Program, so I'm going to mark that. But she also completed the You Call the Shots modules for the Vaccines for Children program and the storage and handling. So I'm going to mark both of those. Next, we have our backup coordinator. Same information is required for your backup coordinator. Also, every re-enrollment, you'll need to complete the annual training requirement. So small fry here is pretty new to the clinic, so she has not had an opportunity to complete any training. So I am going to mark that she has not completed that. There's not a wrong answer here. You just want to make sure that you mark what you have done and what you've participated in, and that way we can follow up as needed. I just realized that I marked an enrollment visit up here, but she actually participated in a VFC visit, not an enrollment visit. So the final step here that's important on this page, not the final step, the next step that's really important on this page is agreeing to the policies and guidelines and understanding them. So there is a link right here. You'll see that it highlights in green. When I click on that link, it will open up the current policies and guidelines of the Idaho Immunization Program. As the person filling out and completing this information, it is my responsibility to make sure that the key staff in my office have read and reviewed and understand those policies. So key staff is going to be my medical director, maybe my office manager, someone who's responsible for storage and handling, definitely the primary and backup coordinators, any other physicians in the office that administer vaccines. It's a great idea if you can get them to read and look this over, because it's important that they understand the requirements of the program. Anyone in your office that you think will benefit by understanding sometimes why you do what you do. Why do you have to count for every single dose? Why do you have to document temperatures every morning? So you'll click on that link and read that information. Then by checking this box, you are verifying that you have, on behalf of your organization, read and understand that and shared that information with those who need to know. So that's important to make sure that you look at and review that. Okay, so this next section, this is where you're going to add the providers who participate in your facility, okay? So obviously your medical director is going to be someone who is administering vaccines in your office. You will have any other physicians, nurse practitioners, anybody who's going to be administering under this facility. So I'm going to fill out the information, and I'm going to click Add, and then I'll see their information located down here at the bottom. Now, this is some of the work that you're going to have to do this year. Next year, when you go through to do re-enrollment, the information will all be listed under the bottom, and you actually can just do some updating. So if you have a physician that comes into the office, you can always add them. If you have a physician that leaves your office, you can just hit the delete button and it will automatically remove them. Now, I know some of you are processing in your minds how many physicians you actually have that work under your organization. IRIS right now will accept 60 physicians. If you do have more than 60 physicians in your office, we are asking that you add, at a minimum, your medical director, and then you send us an Excel spreadsheet to the Idaho Immunization Program that includes this information right here under the providers practicing in this facility into the office. The system will be enhanced at a future date so that hopefully you can just import and export an Excel spreadsheet out of the system and update the information. But right now, we'll just have you send a spreadsheet if you have more than 60 physicians. And there are a handful of you. So after you have added all your information here, okay, down at the bottom you have a few buttons. So the first one is the really important one, and that is to save. Okay, if you do not save on this page, you will lose any of the information that you updated and changed. It will be gone, okay? So you always want to make sure you save. I'm going to go ahead and click my Save button. Oh, and look at that. I forgot some information. So if I forget a piece of information, if some of the information doesn't seem valid for the type of field it is, IRIS is going to give me a little heads up and let me know there's something I'm missing. So I can see right here that a fax number is required, and I forgot to enter in that information. So I'm going to do that now. And I'm going to scroll back down to the bottom of the page, and I'm going to click my Save button again. Okay, so now that I've saved this information, okay, it's letting me know I've saved it successfully so that it's not going anywhere. I can do a couple of things. One is I can cancel. So say I started to work on re-enrollment and I get called away to help with a patient, that's okay. The message, if it's saved, the information's there, I can go ahead and just get out. You really don't have to cancel. You could just leave the screen and it's going to be okay. The information's not going anywhere, but that's what the button would be for. The other thing I can do is I can print this information. Now, it's available here and you can print it during re-enrollment. You don't have to, and I say that because when you get done with the entire process, a copy of all the information will be emailed to you. So it's not something that you have to do. If you want to, you are welcome to, okay? But the important part is to remember that my re-enrollment is not complete. This was just one page of it, so I still have some more information that I have to complete and get submitted. So I'm going to go ahead and I'm going to click the Next button, which is going to take me to the VSC re-enrollment forms, the provider profile section. Now you'll see that my little taskbar across the top has let me know the provider agreement part is completed. So I know I've done that, it's saved, and that information has been taken care of. So the first thing I want to do on the provider profile is select what type of facility I am working with. So you'll see some information up here that is grayed out. That's not a type of facility that you can select as a VSC enrolled provider, but you do have the facilities all listed down here at the bottom. So the majority of you are private practice, okay, solo groups, so I would select that. What will happen is this enrollment type will automatically default to I'm a Vaccines for Children provider. The other thing that I might be is maybe I am a hospital and I only administer the birth dose of Hep B. So that's the only vaccine I'm getting from the Idaho immunization program. So if I change this to birthing hospital, it's going to give me a warning because any information that I've put in here already is going to get cleared out. And granted, thank goodness I just started, so it's not going to impact me. I'm going to say okay. And you'll see the enrollment type change to birthing hospital. And the reason that there's a little bit of difference is when we come down here and look at population for our office, the birth dose is only at birthing hospitals, and so this line will be available for us to calculate and take a look at. So I'm going to go back up because I am a private practice. So I'm going to go ahead and click that. Also going to give me a warning to remind me my information might go away if I make those changes. I'm going to click OK. I can see my enrollment type has defaulted back to Vaccines for Children provider. Okay. Then I'm going to go down to the vaccines offered by my clinic. So as a provider enrolled with the Federal Vaccines for Children program, we are required to what? Have all of the vaccines that are recommended by the Advisory Committee on Immunization Practices, or ACIP, and that is the majority of us. If that is the case, I'm going to click All Vaccines, and you'll see that this section now is grayed out. I don't have to do anything with it. It knows that if I click All, it means all of these. But I might be a specialty clinic, and if you are, you will know this. A birthing hospital, for example, is going to be a specialty clinic because they only offer select vaccines. So I would click that, offer select vaccines. Then in my next section where it says which vaccines, I'm going to go down here and I would click the hepatitis B because that's what I'm offering as the birth dose. Okay, but like I said, the majority of us are offering all vaccines, so all I have to do is click this box. So far in this screen, I've clicked twice. And if I'm a private practice, I haven't even had to click that. It was already there for me. So all vaccines are offered. Now, population. So these great population tables have probably been everybody's favorite part of re-enrollment. It is sometimes hard to determine how many children in the past 12 months you have immunized by their eligibility category. So it makes it a little bit of a challenge. So we have tried to simplify this a little bit. It will be using IRIS data. So always remember that IRIS can only tell you what IRIS has been told, okay? So we're going to go down here to the bottom, and the first thing that we're going to do is put in a 12-month period. And so for this case, we want to look at the past 12 months. So I'm going to look at May 1st of 2017 through April 30th of 2018. Now, I like to type in my dates. So just remember in IRIS, it's 2-digit month, 2-digit day, 4-digit year. You also have the calendars that are available for you, the calendar tool. And when the calendar tool opens up, then you could also just select your dates here. Okay, either way, whichever preference you have when you're working in the registry. Okay, so the next thing I'm going to do is I'm going to click this button that says Update. And I'm going to go back to my tables, and you'll see that IRIS has pulled information to let me know in the past 12 months the number of patients I have vaccinated, their age, and their eligibility category, okay? This is obviously a test organization, so they don't vaccinate a lot of kids, but the information is all there for me. I don't have to try to figure out a tool or go back and figure out a different report. It all populates right here. Now, I know that some of you have systems that you've put in place that you are really comfortable and confident in when it pulls your eligibility and your populations, and that is fantastic. And so you can also override or edit what IRIS has. Okay, so you have your date range in, but you can actually go to each of the tables. So I can click Edit, and I can go up here and I can enter in actually the number of kids who have been vaccinated by my office in the past 12 months. Now, this feature is going to be important if you're a new clinic because you might not have 12 months worth of data in the registry. You might only have 3 months. And so you're going to want to take a look at your information and determine how many kids you actually might vaccinate, okay? And you'll want to make sure that you update this information. So I've updated the information. I will go down here to the table. I will do the same thing, but I want to click Edit first, or I won't be able to actually type in the cells. So that is an important piece of it. Okay, so now that my information is updated, I'm going to go down here and I'm going to say, I've updated this information, but what data did I use? If I don't use IRIS, what did I look at to make that determination? Okay, so I'm going to say that we looked at our medical claims, and I'm going to base it on provider encounter data because maybe my office hasn't been open 12 years, but I know based on my patient population, my numbers are going to look very similar to this. Okay, so I've got my buttons down here at the bottom again. I want to do the first thing that I did last time, and that is to make sure that I save the information because if I don't save, it's going to be lost and I'm going to have to re-enter. I'm going to go ahead and save. All of the information was complete, so it's saved successfully. So once again, I have the buttons that have different options if I need them. I can go back to the previous screen if I would like to, which is the provider agreement, which has all my demographic information. I can cancel. I can print this page if I would like to, and then I want to continue on because, once again, I don't have all of my information complete for the re-enrollment. So I'm going to go ahead and click my Next button. Okay, and we'll see once again, I'm now in Provider Vaccine Brand Choice, but my little task tool is tracking what I'm getting done. So I've got 2 of my 5 steps completed. Okay, so now I'm here with Vaccine Brand Choice. The first time you go through this, you are going to have to mark all of your vaccine brand choices this first enrollment period, and then going forward, this information will stay here. So you won't have to do it every enrollment period unless you want to make a change. That's still something that you can do. So when the date range opens up, it's going to actually default to whatever the next brand choice change implementation date is. So remember that January 1st and July 1st of each year is when brand choice changes go into effect. So anytime during the year you can submit for a brand choice change, but those changes don't happen until January 1st or July 1st. So we're in re-enrollment. It is May, so the next change would occur July 1st. So I want to go ahead and complete this information for the July 1st timeframe. So I am going to go through and grab some vaccines. Just as a note, I am just picking vaccines because I'm picking vaccines, and I am not telling you that there's one brand that is better than another. You have the opportunity on Meng B. I just want to point this out because it is a permissive recommendation. While I think it's a great idea to have it in your office and available for patients, not all offices do, and you can select the NA on this one. In addition, if you're an organization, for example, a public health department, you do not have to submit brand choice. You can order any brands that are necessary because of the populations that you serve. But we ask that you go in and actually, most of you do this already, is choose the brands that you typically carry and administer just to help us with planning purposes. Okay, so I've got all my information marked in. It lets me know who's completed the information, so we have that on hand or when it was updated last. Same buttons down at the bottom, okay? I've got my back, save, cancel, print, and next. So the first thing I always want to do is click my save. Now I'm going to get a new message that lets me know the provider agreement, the profile, and the brand choice have all been saved successfully for the re-enrollment, and now the information is ready to be submitted to the medical director for review and signature. I'm going to click OK. And now you'll see down here at the bottom, I have a new button. that says to submit. So I feel good about the information I've put in and completed, so I'm going to go ahead and click Submit. And it lets me know that this information was submitted to my medical director for review and signature. Okay, so as the admin or person that's filling out the information, I have done my part, except now to probably follow up with my medical director, because there'll probably be a few of us that have to do that. Okay, so you can see in my taskbar, my enrollment is completed, my agreement is completed, my profile completed, my brand choice completed, I've submitted for signature. Now all that has to happen is that signature and have the packet submitted to the immunization program. Okay, so what happens when you hit that submit button is that an email goes to your medical director, and it lets them know that there are documents for them to review and sign. It also provides a little bit of instruction for them and gives them a link to the registry. So hopefully it will help them through the process. So as a medical director, I've received this message, and I know I need to go in now and review and sign those papers. So I'm going to go ahead and log in. Maybe. Okay. I apologize. This worked fine this morning. All right, give me just a second here, and I'm going to fix this. So actually right now, Morgan, if you want to open up the line, maybe we could take a couple questions on the part that we've covered so far.
Sure, that sounds good. So if anyone has any questions, you can go ahead and unmute yourselves. And we do have a question that came in from the chat. So someone was curious whether, let me pull that up, they can use more than 1 year's worth of data if they have kids that don't come into their practice regularly.
So when you're looking at, so just for clarification, and so make an assumption if I'm not, let me know if I'm wrong. But if you are talking about the provider, the profile information for your patients, while I think that, while I understand where you're coming from, because we do that even ourselves when we look at distribution data, the VFC program only asks that you look at 12 months. So, and they also ask that if you're looking at it or doing it on your own, that you are only looking at the eligibility at the last immunization visit. So you don't want to look at eligibility like what they've ever had the whole time. You want to just look at what their eligibility was the last time they came into your office. And I think that the reality is that even though you have additional data, the past 12 months gives you a pretty good picture of what your eligibility is, because as we talk about and kind of what we know with that eligibility is it's an estimate. I mean, we don't know exactly. We don't know which patients might move in or out of our office. We don't know which patients are going to have a change in status where one time they're going to have health insurance and the next time they might be on Medicaid. And so basically what we do is just look at a snapshot in time. So while it's good to have the information, I think really that the basics of the estimate and what we need is to just look at that snapshot in time. That's a great question, though. Okay. I have, let's see here. I think I have this fixed. And of course I don't have it fixed because it logged me in as me. Okay, do we have another question?
We do. Okay. When the medical director gets the email to review and sign the documents, will the instructions in the email direct them to create a login with IRIS, or do they need a login prior to this email?
So the instructions do tell them that they have to have an email, and they have to have a username and password. It does give them the link to the online form so that they can complete that information and have a username and password if they don't already. I know that many of you have already requested that username and password, and so a lot of the medical directors have that information. So yes, they will have to have that. Yes, it will provide instruction. Probably what we will encounter, and you guys have already probably thought this through also, is that we will have some providers who only log in for re-enrollment. And so when they do that, they are not going to be able to, they're going to have to use that reset password. So probably after they haven't logged in a year, they're going to be like, oh, what do I need to do here? And so they might have to use that reset password. So they'll probably need a little encouragement, but each re-enrollment period, we will send out reminders, we will let them know, and we will remind them to go in, log in, make sure their password is reset and that it's working appropriately. Okay, so I'm logged in now. I apologize for that. I'm not quite sure what was going on. So I've logged in now. I'm logged in as a medical director. I have been working with the Russet Pediatrics. So I'm going to open this up, and you'll see that my name is in here, which is totally blowing my mind. All right, we'll see if this is working. I'm not quite sure what's happening here, because you guys just watched me log in with someone else's name, right? I showed you his name. Right there. Welcome for this user. Okay, here we go. I'm not quite sure what's happening. All right, so I am now a medical director. I'm officially logged in. And you'll see that as a medical director, when I log in, the re-enrollment is right on the top of the page. We tried to make it simple so that they didn't have to look through a lot of information. So it's right here. And the part that's important is this review and sign. So I'm going to click review and sign. You're going to see, look at that, my little taskbar is still visible, so I can still see all of this has been complete, but I still have to do the re-enroll and submit. So as a medical director, I can review all the information, and I can do that by looking. So I click on each of the titles. So just like other areas in IRIS, when I click on the title, it will expand the information. So I have the provider agreement here that I need to read and review because I am agreeing to make sure that my whole organization follows these requirements of the program, okay? If I click it again, it will condense that information. I can review the re-enrollment, the provider enrollment, and I can actually, as a medical director, make changes if necessary. Okay, so I can click this edit button, update and resave information. Okay, so I'm going to condense that. Same thing with the provider profile. You'll see all the information that we submitted is all listed here. And as a medical director, I can review that. And then my brand choice information. Okay, and I'm going to go ahead then and also condense it up here where I'm supposed to. Okay. So as a medical director, I have read all of the provider agreement. I am going to also click on the policies and guidelines if I haven't already read them because my vaccine coordinator already told me that I needed to review those. But I'm going to review the policies and guidelines. So I'm going to type my name. I'm going to date it either by using just manually typing in or by using the calendar tool, whichever my preference is. I am going to agree that I have read the policies and guidelines and that I'm going to make sure that my organization is complying with that information. Okay. And then I'm also going to agree that I am going to follow all of the rules and requirements of the Federal Vaccines for Children program as listed in the provider agreement. Okay. So all of that information. By clicking the save, and it will actually generate the enrollment packet. So I've signed, I've dated, I understand my information. I'm going to click Save and Generate. okay, you're going to get a status that comes up that is very similar to when you run any kind of report in the registry. It might say processing or something here. The difference is you don't have to ever click refresh. If you wait patiently, the status will change to done. And like this one went pretty fast. The status changes to done, and then you can do one of two things. You can actually open the packet, and you can print and see the report. So all of the information, the paperwork, like I said, very similar. It's just now all have you filled it out electronically, okay? So you have a copy here of the whole packet. The other thing I'm going to do, and this is the important step, guys, because this is the piece that actually submits it and completes the re-enrollment, is to submit the information to the immunization program. So what I do is I'm going to click on this button. My VFC re-enrollment is submitted to the Idaho Immunization Program. You can now see that my step number 5, which is the final step, is shaded in green. And now what will happen is the medical director who signed the form, the primary vaccine coordinator, and the backup vaccine coordinator, as listed on the VFC form screen, and the Idaho Immunization Program will all get a completed copy of all the enrollment paperwork. So that will all get emailed to you, and then you will have that information. And then you are officially done with re-enrollment. So like I said, I really think that it's going to save time. I do think there's some work that we're going to have this first year as information gets added into IRIS. But like I said, next year, for example, all those physicians listed, you won't have to go and add a whole bunch. You'll just have to make updates or changes. And that is how the re-enrollment process is going to work. So you're done now. As a medical director, I can log out. I have done my part and submitted my documents. They've gone to the immunization program, and then hopefully as a primary and backup, you've also received that email. If not, if for some reason you're not sure, always remember to go to that status bar and look and see if that step 5 has been completed, because that's really what you want to make sure that you're watching for. So if you get your stuff done, you send it off to the medical director, that is one way you can keep an eye on it in case you need to nudge somebody or just remind them that they need to go and take care of that information. It will all be there and processed through. So the other thing that will change with this, and this will be one of the changes this year that you'll see in the policies and guidelines, is whenever you have an update or change in your office, so say you have a new backup coordinator, for example, you have had to submit an email to the immunization program to let us know that contact information and that you've made a change. Going forward, so after you have processed through this re-enrollment, so starting July 1st, you will actually go back into the registry when you need to make a change, and you will share that information through IRIS. You won't have to send an email. You won't have to update and complete a new provider profile. If you need to do that, you will be able to do everything in the registry. And you'll do that by going to the same documents. So when you go down to the VFC re-enrollment and you need to make a change to your backup, for example, you're going to click Provider Agreement. You're going to have to click Next to go to the second screen, but then I can scroll down and say my backup coordinator has changed, and it is now, I'm trying to think who's in my registry, Red Mashed, and she has her new email that you would add in here, but you can put that information in here now. You could update if she has done the training or not, and then you would go to the bottom and you would click Save. And what that will do is it will not only update the information in IRIS, it also will notify the program, and we now know you have a new backup coordinator. So no more emails need to be sent, no more paper forms need to be filled out. Same thing would work if you wanted to make brand choice changes. You'll come to the VFC re-enrollment, you'll click brand choice, say that I want to make updates. July 1st hasn't happened yet, so I actually could still update this information. I decide I want a different vaccine. I can make those changes, and then I would click Save. It will save those brand choice changes, and it will notify the Idaho Immunization Program that those have been changed. So So going forward, this re-enrollment and the information in IRIS is going to be where you're going to make your updates. And hopefully that will save some steps. It will keep all of your information current, and it will help with things like vaccine return labels. We make sure we have the appropriate backup or primary coordinator listed, so those email addresses are current and that return label gets sent to you, for example. So let me just let you know, just as a reminder, that the only roles that do have access to this are going to be admin users and medical director equivalent. No one else will have access to the re-enrollment or to be able to change that demographic information or contact information, okay? Resources available for you in using this process or how to remember what you're supposed to put where, how that's going to work, is this IPI, like Morgan said, is going to be recorded and posted on the immunization program website. Hopefully sometime next week so that it's there and available during our re-enrollment. And then also there is a provider guideline that will be posted and will be distributed to you when we actually open the re-enrollment for this year. Unfortunately, it has not opened yet. I do believe it will open by the end of the week, but we will send out an email and an announcement will be posted in IRIS letting everybody know that re-enrollment is open, and then you'll be able to see it when you log in and then can go through the process. So that should happen soon. So now that we've gone through all of it, are there any other questions or concerns you might have?
Okay, so I've got a couple questions in the chat, and then I'll unmute everyone, and if you have any questions, you can feel free to ask. All right, so first, will the completed re-enrollment documents be available in IRIS after submission?
The medical director will be able to have access to those documents to go look at, and actually, no, they will not. So the information won't change in IRIS, but the actual document packet itself is not going to be in IRIS. That will be emailed to you, and you will want to make sure that you save a copy of that information.
Okay. And then if we have a medical director who is overseeing more than one PIN, will they need to complete the enrollment paperwork for each PIN, and will they see the PINs on their home screen as well?
So yes, they will need to complete the enrollment for each organization. So every single PIN, the enrollment will have to be completed. They also should see all of the PINs that are associated on their screen. So when their username and password is requested, you want to make sure that on that screen you can list the organizations that you need to have access to. You want to make sure that all of the PIN numbers are listed on there. And that way, when the provider logs in, just like you saw in my demonstration, there was more than one organization there. The medical director is going to see that same thing. They will see every single organization listed, and they will have to go into each organization and submit those individually.
Okay. And what's the deadline for re-enrollment?
While we haven't distributed or shared that information, the deadline for re-enrollment is going to be July 1st of 2018. So you will want to make sure you have everything completed and submitted by then. If you do not, then your account in the registry will be suspended and you'll be unable to order vaccine because we have to have that current and updated enrollment on file. After you complete the re-enrollment process, then you will be active again and be able to order that vaccine. So it's really important that you get it done by that July 1st deadline just because it makes it a whole lot easier and less complicated. You can continue with business as usual.
All right. And then if I know that my medical director will be leaving in September, should I wait to open enrollment until I know who's replacing the medical director, or should I just update it in September when the new medical director arrives?
So my suggestion to keep business as usual as much as possible is to complete the re-enrollment because otherwise you will not be able to order vaccine until September when you have a new medical director. So complete the enrollment with the medical director that you have now. When your new medical director arrives, that's when you will log back in and go to that VFC enrollment and go through that process to update the medical director and that information.
Okay, great, thank you. So I'm going to open up everyone's lines, and if anyone has any questions, then please feel free to ask them now, and you can always contact us after the webinar if questions come up. Okay, everyone's lines are open. Any questions? All right, well then thank you so much for joining us for today's webinar. And it will be posted on our website hopefully next week, but definitely in the next few weeks we'll have that up for everyone. All right, thank you. Have a good day.
Thank you.